Right, the last video I did, the mediastinum, I saw the video. The video was fucking repeating itself because I did something. The settings, I made like I think I'm hearing the audio. Like I made like the word I'm saying. I should hear it, but I didn't hear anything. So I thought, okay, I'm all good. But when I saw the video, I felt, oh no, I'm not all good. Then I said, the video is pretty clear. Like I know it can be a bit annoying for the person to hear the voice twice, but uh, I really wanna I really like what I wanna say. I really like value my time, so I'm not really repeating it. Like that's enough. I've been like recording for an hour. So okay, it's now we're gonna talk about the pericardium. What is the pericardium? Uh, just see just like a photo for it. No, I don't wanna like. I just want a photo for it. Just something clear, something to understand what is a pericardium. Yeah, why not? That like pericardium structure. Yeah, yeah. That's good. That's good. Yeah, some people is bombing in our place right now. It's Ramadan, so I think just small kids just playing around, like throwing, like, I don't know, something that would just pop off. Mm. Come on, be quick. I don't get it all day. Yeah, never mind. Alright, the pericardium is a sheer fibrous layer that surround the heart and its great vessels from the top. You can say it's a condom. Yeah, it's a condom which it's used for the protection for the heart because it's got like many functions for it, shape it, and it's like value. That's why it's present. You can say the pericardium starts surrounding the heart from the pulmonary vein till the pulmonary trunk, because the vein, you can say the place of that's vena cava. I'm pretty sure. I'm not pretty sure, but it starts from the vena cava, and because also like behind the vena cava, there's also like I don't know how to fucking show you, but there's like another artery, another vein beside the vena cava. I know that's the vena cava. That's another artery beside it in the same place. Yeah, there's another like vein. Sorry, I'm not. I don't know why I'm saying artery. There's another vein that's called the pulmonary vein, which you can say the heart throws the wasted blood into it to get like filtrated into a fresh blood, the fresh blood supply. The thing I want to say, the pericardium is attached to the from the beginning, or like the great vessels. For example, I don't know how to fucking show it. For example, that's the pericardium, and that's a heart, and that's the great vessels. The heart, the pericardium, just surround the heart, and it attaches to the tail great vessels, and the great vessels, if you can say that's the great vessels, attach it to it. That's the great vessels, and it's attached to it. I can like that, but it doesn't like it doesn't conquer all the vessels, but some of it attached to it, and that's the heart. You can say that's the heart, and it's all attached to it. So that makes sense. I said that it's a C-fibrous layer. That means it's got like synovial fluid. That means it got like pericardium fluid. Yeah, it's got pericardium fluid. Because as if you understand the heart, like that's the heart and that's the great vessels. Like I said, that's the pericardium. It's around the heart, right? Surrounded. and that's a great vessels. For example, I said like if we said it and I opened like the pericardium, I open like a great cut and we see it, you're gonna see there's a space. That space between the heart and the pericardium, there's like a serious fluid. That fluid it helps with the replicate, like it replicates, so it doesn't have like a friction, so the heart and the pericardium doesn't get hurt with like when the heart is contracting and that. It always get like a smooth surface to contract with, and the pericardium can slide through it. So it lubricates it to prevent any like incidents of like friction, which can lead to like fibrosis or like blood clotting there. Secondly, why there's like a pericardium, it helps the heart with many like functions. First of it, as we know, like the heart, that's the most one important one because that can lead to a lot of problems. You know, the heart is function. It's expanded. Like to say, the example, that's the heart, and that's the heart, and that's the pericardium. For example, without you can say without the pericardium, the heart function it expand to get the heart expand. For example, that's the pericardium. The red thing it expands to get some of the blood. That pericardium, it it you can say it gives a limit to the expansion and also the dilation of the heart. Same time, like you can see that the pericardium, the red layer, that it gives like a limitation to the pericard to the heart, so it doesn't extremely dilate and it also doesn't extremely expand, so it doesn't like explode and lead to other complications, which can be like over accumulation of blood, over like excretion of blood. Can cause incidents like hypertension, like hypertension of the heart itself, and that can lead to complications. Like I said, the second option is the lubricants. So the heart when it expands and dilates doesn't like get a friction, so it doesn't hurt, and fibrosis happen there, which can lead to like a lot of complications, which can bring to infection. If there's a blood, maybe bacteria can live there. So that's the other that's like the other function of the pericardium. Yeah, I'm trying to think about like other oxidative functions. Uh, and also, like I said, the pericardium is like the condom of the heart. That's the heart, and that's the pericardium. And for example, the heart's function is to contract, to keep moving, like that. I know that's kind of can seem sexual, by the way, but I don't mean it in a sexual way. For example, the heart expands and then dilates, expands and dilates, expand and dilates. That's give like a limitation for the heart for its movement. So it doesn't, if for example, without the pericardium, the heart just can, get anyway, can be anyway, can hit other structure, can injure other surrounding structure. The pericardium, you can say, doesn't really like let the heart contract in any way. It gives it like a contraction. Like it cannot really contract freely as it does because the pericardium now like give it like limitation where it moves. That's like a function also. And I don't really just write him behind me. Just you asking why it does that, and I answered for you. And I rather like you have a further research about why and why I'm learning that, because it's gonna really help you with your studying and your understanding and building connections with each like concept I'm saying. And thirdly, try to understand what I'm saying. Do not just write it immediately, because it makes you think and realize and coordinate with what I'm saying. So yeah, I'm pretty sure I said all the most important ones, the infection, It conquers the side of and prevents infection and called lubrication, and it prevents like overflowing or overdilation. All right, the pericardium. I hope like I got like another one. So I can use that. The pericardium, you can say, it's is built upon like three. For example, that's my hand, okay, and that's the heart, and that's like the three layers. That's the heart, and that's the three layers of the pericardium. Alright, and that's like the third layer. Alright, that's a two layer. Right, that's a two layer because that's a layer. I'm gonna take, okay, now, that now the heart. That's like the outer layer, which anything that's outer, we call that like a visceral layer. Right, like that's the fibrous layer, the one like which most like function is like to it's made like otherwise it's made by a lighter dense connective tissue. Yeah, yeah. Its one function is like for the protection. It got like adipose tissue, it got nerves, got arteries. Because it's the most one. It's the outer layer of the heart, the pericardium, which also supplies. You know that the pericardium is in the cell and try to uh, maintain and supplements and support to the heart by the nerves and the arteries and the veins and also the adipose tissue. And the adipose tissue can be used as the lipotoxic to prevent any like over toxation, over like accumulation of lipofuscin, for example, and also it helps like against like shock trauma, which acts like a trauma absorber. It's the adipose tissue, the fibrous tissue, and it's made about and of it's made of yeah of a lighter dense connective tissue, like I said. Just I'm trying to just remember one bit. So all right, yeah, I'll make it clear then. The second layer now, that's the fibrous layer, right? And that now that's the two other layers. That one now there's like you can see it's divided into three layers, but one layer is lined and the other layer. That means this one just sticks to the other one, and it sticks to it because it's you can know it causes like an over attachment which is used to so the fibers doesn't get like separated. And at the same time there should be a space. I understand that. I understand. I will get that in a moment. There is a space which uses uh, which is uses to keep like the fibrous tissue attachment, also that acts like an protection and a support to that layer. Now, okay, now that layer, okay, that layer that lines the fibrous layer, it's called anything that's in the outer and have like a deeper layer to it, and it's divided into two layers as like the same layer of the idea of like pleura, pericardium, peritoneum, all that things. They have like a parental layer and they have like a visceral layer. The parental layer is the one that lines the fibrous tissue, and its main function you can say that it got like coronary arteries and got like phrenic nerves, because it's responsible for like the pain sensory function for the heart to feed any like pain and like agnosia if there's like an over compression over dilation, so that the person or the patient know that and he can like tell the doctor that he's feeling that. That can be a sign of agnia, which is like a discomfort or pain, a sharp pain in the chest. So yeah, it got sensory like motors, and got like from the phrenic nerve, cause the phrenic nerve, it passes through the three and C3 is C4 and C5, and also the phrenic nerve main function is to keep the diaphragm alive, keep supporting it with like a brain connection, like an illogical connection between the brain and the diaphragm. So it passes through the parental layer to give that support to it also. Then like between like okay, if I'm trying to do that now, for example, that layer, that's the heart, okay. That layer, that if that the visceral, if that the peritoneal layer, and that's the visceral, for example, it got like it's yeah, it covers, you can say, the artery and it got supplements the coronary artery and the autonomic nerves, yeah, for help with its contraction and its knowledge, because you can say its main function to secrete the synovial fluid as the pericardium fluid, which help with the application to create a free friction surface. Now that parental layer, okay, if you wear the glove for a second, now my skin is the vessel layer, okay, and the glove is the parental layer. There is a space, right? There's a space between them. That's where the pericardium fluid or the synovial fluid, which helps with the replication to create a free friction surface, and yeah, to create like a free surface, and it's filled with like hydrothoracic fluid, like synovial fluid. It's like a specific fluid which helps in creating the friction surface, and it's present between the parental layer of the pericardium and the visceral layer, which is my skin. That space is called the pericardium cavity. That's what I'm trying to bring out. And like I said, the pericardium cavity is filled with pericardium fluid, the synovial fluid, to create the replicating effect, to give like a free friction surface. Um, what I also add out is my skin has another name for it. It's called the epicardium, which is the dense. Is that dense is one of the like layers of the heart. You can say that if you study about the pericardium histology, you're gonna know like the epicardium is the last layer of the heart. The heart has three layers. Has the inner layer, which is called endocardium. Has the muscular layer, which is the one which helps with the contraction and that, and got like the cardiocytes, which is responsible for contraction and conduction. You know, the heart function, contracting and like sending and working at the muscular pump. It's called the myocardium, and the last one is called the epicardium, which is the visceral layer. Is made of like a dense connective tissue, and it's used like to protect the heart and yeah, to protect the heart, because it got nerves and it got arteries and it got adipose tissue to help us to prevent like lipotoxicity, and the oval like secretion of accumulate or the over the accumulation of lipids, or the over metabolism of lipid, which can lead to like secreting toxin, a toxigenic substance which can like harm the heart and like that. Yeah, and like if we're gonna only start about the anatomy and nothing else, I don't think there's like anything else. I have like pretty sure like made it very understandable. If you're gonna like talk about the sinuses now, the heart of the pericardium, there's like some spaces of the heart. For example, just get like two more. What's called the heart. Okay. I think that's the best one. Right, that's a heart. It's a beautiful heart. That's the blue line is the superior vena cava, and the red line like tube is the aorta, or like the arch of the aorta. Right, and the other like thin tubes are like the coronary arteries, and like the yellow one is the pulmonary trunk. Okay, that's lovely. That's lovely. You see the space between the vena cava and between the aortic the arch of the aorta. That space is we call a transverse potential sinus, and its function you can say like during surgical procedures of the heart, for example, for treating the heart and needing for like if the heart for example is bleeding a lot of blood and we're trying to like suit it up, the heart keep moving up, keep beating and keep moving, and the surgeon will not able to treat it, and try not will not be able to sew it up. So we gotta stop the heart from moving, which you can say gonna lead to stop of the supplements and the support of blood supply to the whole body. That's correct, but there's like another during the surgery. There's like machine responsible for that. That's like an external heart machine, and there's external heart respiratory, which supplies the human with oxygen and blood throughout the body, so he doesn't like die during the procedure. That's that stop of the heart, the stop of the rhythmity of the heart can lead to the overexpansion of the aorta, which can lead to the explosive of the rupture of the blood of the aorta, because the pressure gonna be too high, and you can say the blood gonna be will not be able, because the contraction of the ventricle, that you can say that the ventricle just gave the blood to the aorta, and they haven't given it its push that's gonna send it to all so it have given it only, and the blood gonna be too large, and because the heart also manages like the heart which is receiving to the aorta to the ventricle giving to the aorta, the atrium sending giving it to the ventricle, then the ventricle give it to the aorta. The heart manages that, and without the heart like function to manage that, sometimes the pressure the ventricle can give the atria, the left atria for example, can give all the blood into the ventricle, and the ventricle will not pump and just gonna pass the blood to the aorta. So the aorta will not understand that it should send the blood to the periphery, and just gonna keep communicating it. It's gonna keep communicating it to the rupture. In that case, the surgeon he put his finger in the transverse potential sinus in that space, and he closes the ruptured aorta till he fixes and treats and soothes the heart. Then he soothes. He start like the heart functioning. He brings also like he then he soothes the aorta. Then the surgeon tries to reboot again, like restart again the heart function. So that's like the purpose of it. That's like it's present where I don't really remember like special once, but you can like remember it because I didn't remember it. Yeah, like I said, it's a fibrous layer. The first layer is a conical. That means it have a condom shape. Okay, it's a condom shape that, like I said, it covers the heart from down till the vessels of the heart, which consist of the pulmonary trunk, superior vena cava, and the diaphragm, and like that. And it covers its base and is pierced through the inferior vena cava and posterior pierced by the pulmonary vein. That doesn't matter. And then it's subdivided into the second layer, which is half the layer, which is the vessel layer. It's the one that I was talking about, my skin, right? The epicardium one, which is insensitive to pain and temperature like that, because it doesn't really have a connection to the spinal cord. That's why it doesn't have like a sensory innervation, unlike the parental nerve, because it got the phrenic nerve. It's supplied by the phrenic nerve. Supplied by the phrenic nerve, which supplies the C3, C4, and the diaphragm. So that, and it got sensory innervation. So that's why maybe if you got a pain in the parental, you're gonna feel it in your shoulder, because also the C4, C5, and C3, C3, C4, C5 supplies the right shoulder. So you can maybe feel, if you feel a pain there, you're gonna feel also pain. You're gonna maybe you can feel like a pain in your heart and at the same time a pain in your right shoulder. How that's like another theory that you can feel pains above above your tissue, like you feeling a pain in your tissue and in above your body, and not above your body, in your tissue. But in actually it's visceral pain, it's inside, but your body directing the pain into other parts or closer parts, so you can understand that something organic or something visceral is hurting you. And like I said, a pericardium cavity is a thin space between the two layers of the cardium and contains free fluid of the synovial fluid. Then the sinuses of the pericardium, the transverse sinus boundaries. If you're gonna imagine it, yeah, you can say the space is in the front of the ascending aorta, like that one, and the pulmonary trunk. But the pulmonary trunk, you see the yellow one. There's supposed to be like a one just like behind the ascending aorta, but they have removed it here, right? Trying to make it more obvious, but I think that's like the most obvious one. I don't wanna like, yeah. For example, he cut that's now down the ascending aorta, and he cut the superior vena cava, and he cut like a lot of things, but that's, you can say that's the transverse pericardium sinus. But I feel like that's the best one like that describe it. So you can say the space and it stands in front of the arch of the aorta and the pulmonary trunk. And by without even seeing it's standing, by mean it's standing now behind, like behind it is the superior vena cava. So posterior to it is the superior vena cava. Like I said, and fuck the aorta, just fuck the artery, you know, upper part of the aorta, fuck the artery, you know. But yeah, it's because if being honest, yeah, maybe I didn't see it, but that's the right aorta, okay. That's the right aorta. It's like receiving the vena cava, receiving the both vena cava, the two terminals, the inferior vena one and the superior vena one. So yeah, you can say it stand behind it, the posterior vena cava, and even without need to like it's side to side it, maybe the other branches or like the other great vessels, but above it, you can say I really know, but below it is the right atrium. Yeah, just that. Okay, it's like maybe, yeah, it allows also that this distension is like distension means the expansion of the aorta and pulmonary trunk, but I feel like the most like function and the most like surgeons have felt there is a great function for it, a great need that he can put his finger between the arteries. That, but you can say also get another like function, which is expansion of the aorta. So as the aorta is is a stretchable lumen, that's mean like same of the heart. When the left ventricle sends its blood into the aorta can expand, and that's the lumen. For example, there is the lumen of the aorta. It can expand, but you can see the lumen doesn't really have a pericardium, but it needs space to expand. That's the idea. But maybe that's why the aorta doesn't have a pericardium. That's why when it expands, it can overexpand and just have like an overexpansion where it compresses on the other organs, or the other tubes. If that makes sense. So that's why maybe aortic aneurysm can have can cause like a mediastinal syndrome. A mediastinal syndrome is anything that's compressing on having like a compression on the content of the mediastinum. I said that in the last video, but I hope I hope you like see the video. Now, the last thing, not before the last thing, there's something called the oblique sinus. It's just like a space, yeah, it's just a space behind. You can say, it's just behind like it's a space here. You can say that. You know that the left atrium. Wait, yeah, the right auricle, the pericardium, the aorta, the pulmonary artery, the left auricle, pulmonary vein. I don't like that. Like, maybe if I search like the mediastinum. Yeah, for example, do you see that space between? I don't know. You didn't know, but do you see that space between the ventricle and the heart upward? Yeah, that's called oblique sinus. Okay, it's just a potential space. It's a space where the heart can expand and dilate freely uh, through its life course. It helps it to, and I know there's another sinus here, and there's not sinus, but that sinus is special because it can like cause problem because it's inside of the pericardium. You can say that it's like, for example, the pericardium anchors from the great vessels till the heart and till like the other side of the heart till it reaches the other side of the great vessels. Like, for example, like I said, that's the pericardium, and that's the heart, and it's surrounded. It's that way and that way. If that makes sense, okay? That way and that way, okay? And the great vessels here, the great vessels. The heart just can be sometimes too big. I want to bring a small heart. I think I show it somewhere. Yeah, here's it. Yeah, for example, that's a heart. Okay, that's a heart, and the pericardium surrounds its heart completely, and that's the great vessels, and it surrounds the great vessels from all the places. Okay, inside that, okay, there is the two sinus I talked about. Okay, the transverse sinus and there's one behind the heart, behind the right atrium. Okay, it's called the oblique sinus, which I said its main purpose to let the right atrium specifically. It doesn't mean specifically, but specifically the right atrium to contract freely, but it's the heart in general to contract freely. Um, it's present behind the left atrium, not the right, the left atrium. By accident, I said that. Behind the left atrium, and it's like I said behind it, because it's inside of the pericardium cavity. Behind it is the fibrous pericardium, which is what's called the farthest layer of the pericardium, lined by the pericardium and the ascending aorta and the esophagus. Doesn't really important. If you want to know the diet of it, yeah, if you bring like a great photo of it. I just want to see like, yeah, that one. Sorry, I don't know, like the internet is weak. Never mind, dude. I just wanna like clear it off. Just clear it. I used it in the last video. I don't know why I'm doing that right now. Mm. Yeah, screw that photo. Okay, never mind. Um, like that's the heart. Do you see like the water? Then like the superior vena cava. Behind it, there's like a red tube, and there's like a red tube written on it like the pulmonary vein, right? Pulmonary, I don't know, A N, which stand for vein. There's like a space, right? There's a black space. Okay, that's the Greek sinuses. Okay, that mean in front of it. Oh, it stands there in front of it is the right atrium, but behind it is the pulmonary vein and the I don't know, something red, maybe the aortic branch or something like that. If you see that, you're gonna probably be right. No, cause yeah, you can say it's right. Yeah. It's the ascending aorta and esophagus, and cause, but you just can say, you just can say like. You just can say like behind it is a fibrous layer, because as I said, these sinuses are present in the pericardium, and the pericardium, like I said, cavity is present between the epicardium, like I said, the skin, and the parental layer. If you go with the glove again, that's the pericardial cavity, which is the oblique sinus and the transverse sinus present in. So behind it is the fibrous layer, but you can say yeah, behind is the aorta and the pulmonary trunk, but that's not really important. If you're gonna say lifted, then yeah, maybe lifted is superior vena cava. Like yeah, if that's the left, I know that's the right. That's my right hand, but cause we're seeing it in opposite, you cannot say that's right and that's left. In scientific reasons, cause he's standing in opposites, the opposite side of us, so everything is opposite to him. So we gotta switch everything, like we're studying on this stuff. If we're gonna study on this stuff, then right, yeah, that's the right part and that's the left part. But that's the thing. If you're gonna study on a person in front of us, that's 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 the right part, which is the left to my side, and that's the right side. That's the left side, and on his parts. If that makes sense, that means the right on my left is his right, and the left on my right is his left. If that makes sense, I hope it does. So yeah, left to it is the superior vena cava, and right to it is the aorta. I'm pretty sure I'm gonna be right. Like I said, left to it. I didn't say that left to it is the superior vena cava. Ah, never mind. Wait a second. Oh, what? Why that makes doesn't make any sense. If that is that how no, that doesn't make any sense. Cause isn't like it's behind the left atrium. Yeah, that doesn't make any sense. Cause if it's present at the left atrium, then how it how it is it's right in the inferior vena cava. It's supposed to be the superior vena cava because the left atrium is present at the superior part. If you bring a heart, for example, like if we just write like heart, yeah, that's that's the what's called the left atrium, and behind it and above it, it's the like the superior vena cava. So behind it is the oblique. So to the right of the oblique, which is the left of the oblique, is the superior vena cava. So I don't know why the hell did it said like primarily veins. It's weird, and then it said like and food, and to the left of it, to the right of it, is supposed to be the aorta, but it said the inferior vena cava. Maybe if you it's according to which side if you're viewing it, you can be right to a concept, but in my concept, in my way of viewing, I think no, that's wrong. But I believe you should go just by the handout and don't really ask questions because I don't really make the rules. And that's the last thing. Okay, the last thing now is something called pericardial fusion. Pericardial fusion, in conclusion, yeah, that pericardial fusion is an increased accumulation of the synovial fluid, of the pericardial fluid, have accumulated between the two serous layers, which is the vesicular and that one, for example. Yeah, that one, which is just a build up fluid accumulated in the serous, between the two serous layers, which is the vesicular layer, the epicardium, and the parental layer, which is present in the pericardium cavity, like I said before, thousands of times. Maybe due to an infection, inflammatory process, I don't know, bloods, and then maybe a tear in the heart have happened. So just an increased blood have been secreting out from the heart and been getting into the pericardial cavity. Maybe that's called a hemocardium, but in a shortcut, it makes like a compression between the other structures and can cause like a lot of complications like compression, like mediastinal sinus, which is compression between to the other structure of the mediastinum, or doesn't really, it over limits the movement of the heart, which you can say you're moving your heart, or you stopping the limitation of the movement of the heart, and you can say the heart is not working efficiently to its best. So you can get complications like necrosis, or like decrease in the blood supply, like myocardial infarction. Even you can get a heart attack by that. Um, what do I want to say also, and that can cause over like infection also, like over, if there's too much fluid, it can cause like an infection. What else? Yeah, lots of complications. And also, yeah, it can, you can say it prevents the dilation and expansion of the heart, so the heart cannot really work efficiently as it and it's used to, so gonna cause a lot of complication like a stroke, something, venous congestion, a lot of things, like mainly a stroke. As I said, the cure for it is a syringe, as you say, is a surgical syringe will secrete out the fluid out by like injecting like an injection or like a needle into the pericardium, which we're gonna inject it between the sternal angle, the sternum, and the fourth rep and the sixth rep, or between the sternum and the fourth and sixth external rep. And for example, now that's the rep cage, right? We're gonna count. That's the sternum in the middle, and that's the first. That's the second. No, that's the clavicle. That's the first. That's the second. That's the third. That's the fourth. And that's the fifth. And that's the sixth. Between the fourth and the sixth, you can inject the needle into the pericardium and just inject out the fluid out, and try to avoid the lungs and the fluid, of course. And you can say that's it. So the pericardium cavity is filled with excessive fluid, hydrothorax, synovial fluid, pericardial fluid, so many, which prevent the normal expansion of the heart, which is called extension of the heart, leading to various venous congestion. As I said, venous congestion means if the main vein of the heart is the vena cava, and you can say the organs which need like a constant blood supply and care isn't receiving that care constantly. It can cause like a necrosis in that organ. So that in general, which you do because the wasted blood that's supposed to go to the vein isn't going in its time, and at the same time the needed blood, the fresh blood that is needed in that time isn't getting received in that time. So you can say that the organ is getting necrosed, it's dying. So that dying process leads to like the enlargement, because you can say like the cells of the organ is just like over accumulating. The metabolites is over accumulating. The wasted blood is over accumulating. Its waste support is over accumulated in that organ, so it can lead to congested neck veins, like a jugular vein with the vein just popping because it's not moving anywhere, and enlarged liver, which mean like as I said, and of course weak pulse because the heart isn't like working to its efficiently, and maybe leads to death. And the treatment is drainage performed by the needle insertion within like 1 centimeter to the left of the sternum, and the fourth and sixth costa the cartilage. And of course, do not hit the lung or the pleura. Do not insert it through it. And that's it. That's all you need to know about the pericardium, or the anatomy of the pericardium. Thank you. If you like the video, don't forget to put any suggestions in the video. Of course, if you like the video, don't forget to boost the algorithm for me. Like it, share it, subscribe, tell me like a suggestion you want to add. You don't need to like the way that I teach, what things I can change, what things I can improve. I like that, you know. And I'm really happy that I try to help somebody that's trying to understand the pericardium. And you can say the most simple anatomy lectures you'll ever see and read. But I really hope that you liked and you understand what I'm trying to view. And I hope that all makes sense in the end. Alright, Ramadan Kareem, and I hope you all have a nice iftar. If iftar started or not, I just hope like you have a great day, and see you later.